Hello, good evening. Welcome back to I Care for Your Brain with me, Dr. Sullivan. I have not been able to be here for a couple weeks, but here we are. I was very inspired by some of you in the essential tremor community. Now, maybe if I put my glasses on, I'll do better. Who had reached out to me and said, hey, it's been a while since you've done something on ET. Do you think that you could maybe do some kind of a research update? So what I did is I go to the research scientific literature and I look through what has been published in the last couple of months on different topics and see if I think there's anything that is important or curious or worthy of us sharing together as a community. So wouldn't you know, tonight is based on what I found. So we are going to be talking about the worsening of essential tremor after COVID infection. And this is a letter to the editor that was published just last month, 2022, in a scientific journal called Cerebellum. Now, as you ETers know, that is the most important part of the brain when we are talking about what is going on for you. Not only do we believe that this is one of the most, if not the important part of ET, one of the things I've tried to really get out there is that when you have a disorder in the cerebellum, that we expect you are going to have a combination of not just motor symptoms, but also what we would call non-motor symptoms. These are cognitive and emotional symptoms. We can also add in things like eye movements, which could be under physical, but one of the challenges you all have as a community is that ET tends to be very defined by its one singular symptom, which is the tremor. And part of what I have enjoyed doing in the last few years is empowering and enlightening all of you that there is a whole nother side of essential tremor, which has nothing to do with the tremor in the sense that these things exist side by side. They're related in the sense they come from the same part of the brain, but if you don't know these things, what I worry about is you can walk into a doctor's office and if they are old school, conventional, don't necessarily keep up with the literature, they may try to keep you in a box that this is just a movement disorder that just has a tremor that goes along with it. And the risk is that you will then feel not understood, invalidated, be made to feel like maybe you're a little off your rocker. So I like to bring this information directly to the community. So when I saw this, I thought this was very timely because I know a lot of you in the community have had COVID, and there's also a lot of traumatic stress and psychological fear that goes along with COVID. And I thought it was a good topic to start a conversation so you can all educate me as I try to educate you as to what is out there in the scientific literature. So this question of a viral infection affecting a movement disorder actually goes back to the Spanish flu in 1918. So this remains the most commonly cited relationship between a movement disorder and a virus. So the Spanish flu was influenza A, also an H1N1, and almost every single patient, according to the records, who had brain involvement from influenza A developed Parkinsonian-like symptoms, specifically the tremor. Okay, and so this was the first connection between something viral and something that was happening in the motor system. We then had information about how an infection specifically affected Parkinson's disease. And in fact, if you go and look in the literature, there's a number of papers out there that talk about the worsening of tremor, the worsening of a symptom called bradykinesia, which is the slowness that we see in Parkinson's, and also a change in gait, a change in walking after severe COVID. Okay, but up until this report that we're talking about tonight, nothing has been published on a possible impact between essential tremor and COVID. And just kind of a sidebar, this is kind of another example that despite ET's strong prevalence over Parkinson's disease, there is so many more resources that go into funding Parkinson's research than there are ET, right? So we've got a boatload of stuff out there on PD. This is the first time we're seeing something on ED. So what this is a case report, which is not a controlled study. So first off, we can't really conclude too much about this, but it's a start. And what I think is going to be really helpful tonight is all of you listening to me sharing in the comments your personal experiences, because that is a general philosophy of neuropsychologists and certainly myself, that yes, we are experts in brain and behavior, but we seek your expertise. You know yourself better than we will ever. You know your life history and your experience of living within a brain that has ET. So please, as I'm talking tonight, share your experiences as you are comfortable. So this case study is talking about one person who had ET, and what is critical is that there's evidence that is objective that his tremor got worse after he was infected. So what that means is it's not subjective. It's not just someone coming in and saying, hey, I think it got worse. That's what impresses me, although we do want to be critical thinkers and think through, are there any other reasonable explanations for this type of a finding? So I think we want to pay attention because this could be validating important data, but we also want to think about it with a little bit of a skeptical eye because that's how good science gets done. So what's interesting here is this person just so happened to have undergone a really detailed assessment a few years prior to having COVID, and then after went back and had a very similar assessment. So they were able to make some comparisons over time. This person also tested positive on more than 4 consecutive PCR swab tests in a 28-day period. So we can conclude that they definitely had COVID. This was a 60-year-old right-handed man. He had been diagnosed with ET in 2015. And in July 2021, he reported that things started to get worse, okay? So he had symptoms like many of you starting in the teenage years as a 17-year-old with an action tremor of the upper limb, slightly more on the left. And it got better after drinking alcohol, which is something that we have all talked about. He also had a family history of tremor on his mom's side. So in 2015, he started propranolol, 40 milligrams, and had an MRI in June 2017. Now, what we know is that an MRI is not necessarily going to be able to show us a movement disorder. There are functional scans where we can look at dopamine reuptake in things like Parkinson's disease. But in essential tremor, we really don't rely on things like MRIs and CT scans. What we rely on is a neurological exam and a neuropsychological exam. But when this person had an MRI, they did find that they had had a small stroke in the left pons. So the pons is in the back of the brain, right by the cerebellum. Important to note that for our future critical thinking. And there are functional connections between the pons and the cerebellum. Okay, so keep that in mind. So what's important there is he might have been going into COVID, not just with essential tremor. And I think that's important because one thing that can happen in all neurological conditions is once you are labeled as having one thing, it's like the diagnostic workup can stop and that's all you can ever have. Meanwhile, we know, especially with ET and Parkinson's, there is tons of overlap. So it very well may be the case that some people have ET and they also have little strokes. So a human being, has a right to have all sorts of things happening to them. We don't want to just artificially reduce things down to one diagnosis. So he was in a longitudinal research study that was looking at ET progression, and it was in June 2015 when he had his first very comprehensive eval, and then back in December 2020. Well, April 2021, this is when he was diagnosed with an asymptomatic COVID infection, and I think that that is a very interesting feature of this article. So not bad COVID, not in the hospital with a ventilator COVID. This is asymptomatic. I'm positive, but I don't seem to have symptoms. No respiratory symptoms, none of that. So 3 weeks later, he goes to the neurologist and says that over time, in the last 3 weeks, my tremor has definitely gotten worse ever since I tested positive for COVID. So in July 2021, so this is 3 months after he is infected with COVID, they repeat some of the tests, and what they found is that the postural tremor worsened by 55%. Now, how can you assess postural tremor in yourself? Well, it's pretty easy. Put your hands up over your head like this and observe how much your hands are shaking. Okay, that is your postural tremor. They also noticed, this was crazy, that the tremor in the arm or the hand worsened in this person by over 100%, 102% worse tremor. Okay, they tested him again in November, so that's July, August, September, October, 5 months later, and the tremor was still not better. It was still as bad as it was at that first 3-month mark. And I know this is a lot of data coming at you, but it's interesting and it's important. So there were no changes in mood. There was nothing changed about his cognition from the baseline. His labs didn't change, his brain MRI, nothing that changed. So if you take that on the surface, you would think, oh my goodness, what is going on with COVID and essential tremor? Well, I want us to think through a couple things. One is essential tremor is progressive, unfortunately, meaning that it changes over time. That timeline is different for everyone. So is it possible that this was just the ET worsening? Is it possible that something else caused the worsening? You know, this wasn't a controlled study. This was a case study. Sorry about that, I got a call. It's observational, so we can't really infer cause and effect, okay? And remember that MRI, this person had a small stroke in the pons with those connections to the cerebellum. So that is all kind of like possible future doors to research. But it led me down a different road of research, which is just related to the worsening of tremor after many viral infections. So what I have come to wonder is this a COVID thing or is this a virus thing? Because I know from my patients that after a flu, I've even had patients tell me after like a cold sore, something that could be related to the herpes simplex virus, that they notice a worsening of their tremor. And if you look in the literature, you can see that there's a very specific immune reaction that happens with tremor that makes a lot of sense why there might be reduced blood flow to certain part of the brains through inflammation that is making the tremor symptom worse. Now, interestingly, when you look at the brains of people who have been infected with COVID at the time of death, if you look at the brainstem and the cerebellum, that's where the infection seems to cause the most inflammation. So that is of particular interest to us because that's where we know ET sets up. So is there some specific connection with COVID versus essential tremor? We also know, it's not just that the cerebellum is the problem in ET. We also know that it's in particular the Purkinje cell loss. And that's what the authors of this study proposed, that basically that there was a virus-induced immuno-mediated behavioral cerebellar circuit dysfunction. So fancy words to basically say there can be a worsening of symptoms because of an immune system reaction. So part of the limitation in understanding this is we don't even have a fully accepted and understood definition of what exactly ET is, right? Those of you who know me know that I am really pushing for the non-motor symptoms to be recognized, and we're getting there with ET plus as a new diagnostic category. But boy, do we still have things to learn, things to communicate to the public. There are still some neurologists that don't believe the cerebellum is involved with ET. So now we're trying to put together a pandemic infection with a movement disorder that isn't necessarily clearly defined. So it's a lot of fuzzy, right? Because we don't really even understand COVID in the brain that well. But what I do think is compelling about this story is the timeline, right? So gets the infection and within 3 weeks, which is about the amount of time that you have some secondary immune responses, that there's something there. And so what I wanted to do with this talk was to reach out to all of you folks all across the world who follow me who have ET, and like, let's get a conversation going. What has been your experience? Not only with COVID, but I would love to know in your life experience of having essential tremor, what happens to your symptoms when you get the flu? What happens if you have another type of viral infection? Some of you live in parts of the world where you've maybe had malaria. I would love to understand with different viruses what you all have experienced. So what this report clearly emphasizes is that we need to pay extra attention to the overall immune system and support in our people with ET, not just with COVID, but with viruses in general. I just had a patient say to me today that their intention was to continue to wear the mask, not necessarily out of fear of COVID, but that this pandemic really taught them a lot about viruses and community transmission, and that they don't want to be exposed in general to things like the flu. This woman's husband had a significant respiratory issue, and she just felt that it's a new behavior that we have to adopt to keep ourselves safe. And so I've been really thinking about that today in context of this talk, and really thinking about, our vulnerable communities and what is it that maybe you all need that's different than the general population. Because right now everyone's going so happy, at least where I live in the United States, that masks are now optional in the schools, and people are really rethinking their safety precautions. But what I would say from this data and what I now understand about viral infection and movement disorders, I want you all to be extra careful. So not only does that mean staying up to date with the vaccines and the boosters with your doctor's blessings, but let's continue the new habits of hand washing. Okay, wearing a mask, at least when you're in a confined area like an airplane, staying away from processed foods, trying to eat as much organic fruits, vegetables, lean proteins that you can. Exercising regularly is very important to keeping your immune system strong. Hydrate. Opening the windows in your house whenever you can to bring fresh air in and get viral particles out. That's very important these days. Long periods of uninterrupted sleep, and figuring out how you can best manage stress. Those are really the top scientific findings that I know of to support immune health. One of the questions I always get from people is, isn't there a supplement or a vitamin that I can take? And my general feeling is that there's not a lot of scientific support for the fact that those things actually help unless you're deficient. There may be one exception that I found in this research, and this was done on folks with Parkinsons, but we know they're kind of sister communities to ET, and this was from vitamin D. So vitamin D does have a potential antiviral effect and may play a significant role in managing respiratory issues. So people with PD, very interesting, are more likely to be vitamin D deficient than their peer who doesn't have Parkinson's. And supplementation to get them to normal levels may, cautious scientific word, improve motor and non-motor Parkinson's symptoms. So it seems that a daily dose of 2,000 to 5,000 international units of D3 in people with PD might help to reduce the risk and the severity of their COVID. Of course, this requires more research, and right now I'm reading from the article, so those are their words. What I would say from this is absolutely stay on top of getting your vitamin D checked. And if you've been told you need a supplement, sometimes it can be very easy to let that slip because you have other meds, and people can feel resentful of taking medications and sometimes let the non-essential ones slip. But what this really reinforced to me is how important it is to make sure you're staying on top of your basic vitamins like D, vitamin B3, iron. These things are really, really important to the immune system. So some of you may be here because you have watched my 4-hour essential tremor webinar on the non-motor symptoms, where we go through all sorts of aspects of ET that many people had not really heard validated before. And so it's been a wonderful experience getting to know so many of you in the community through that in honor of coming out with a new ET video today, I wanted to offer that webinar at a 50% discount over the next week. So what you're going to find is in the comments, is a link to go sign up. So it's 4 hours. It took a long time to put it together. And what you get access to is the link of me doing the webinar live and the PowerPoints that go along with it. You will have the link forever. It is yours to keep forever and ever, as long as the internet is alive. If you are unable to afford this webinar, you can message us and we will figure out a way to make it work. We appreciate the support of the I Care for Your Brain community. It's a wonderful way to let us know that you like what we're doing, the type of education and empowerment that we're trying to spread in the brain health communities. But I also know that having a brain health challenge can mean you're on a budget and a very specific income that doesn't allow you to buy these kind of things. If you need support, we are here to help you support yourself and your journey for education. And if you're able to support us with purchasing it, that really goes a long way for keeping us offering these types of educational opportunities. So really, this is meant to spark a discussion. I try my best to keep up with some of the Facebook groups, Essential Tremor UK. I went on there last night to see if anybody was talking about COVID, and I was so touched to see that you all have so many of my videos on the top, and when a new member joins, you've got my name on there and telling people they should watch my videos. It really meant so much to me, because this mission is all about spreading high quality information and empowering those of you who are living with these conditions to get a better scientific understanding of what you are going through. Because I'm afraid if you just leave it up to the medical community and to the neurologists, you might not get what you really need. And so we've got to kind of do it ourselves. Thank you all so much for being with me. I look forward to reading the comments in the next few days, and please join us for that webinar as you are able. And I will hopefully see you all very soon with ongoing information